have you here with us today. And before we begin, I will just walk you through a few housekeeping points. Our speaker today is our mad scientist, patient billing expert, and the founder of the Society for Better Billing, Chris Cordero. He's tired of billers not having adequate resources, or as Peter Finch from the movie Network likes to put it, he's mad as hell and he can't take it anymore. In today's webinar, Chris will be diving into the deeper challenges of the patient billing community and share with you his manifesto for bringing billers together. At the end of the webinar, we will host a small Q&A session. So if you have any questions, please type them in the Q&A tab in Zoom, and we will be happy to answer them after the webinar. Thank you for attending, and we hope you enjoy. And now over to Chris.
Okay, well, thank you, Julia, for that introduction. And, for those who've been following for me, for my inbox career, you may know me as your account manager, your implementation manager, now the product manager. For those who know me maybe a little bit outside of inbox, maybe at a conference or through other webinars, you may know me as the billing wizard. But now I come before you as somebody who's been working in the medical industry for a decade, and now who's been working in the patient billing industry for 4 years. And let me tell you something, it's really, these last 4 years have really rocked me to my core. There have been a lot of positive experiences, gaining relationships with billers. I've been involved in the implementation of hundreds of billers, thousands of practices. And you do learn a few things, and I've learned a great deal, but one thing really sticks out. And that's that, quite frankly, the medical billing community could use a boost. When I worked as an insurance broker, I saw the influence of legalized kickbacks and incentive programs, which influenced the type of care that patients received. Though at the time, I wasn't really complaining so much. Being a broker, we got an all expense paid trip to the breakers in South Florida. It was really nice. But, it's really that influence. And then I also worked on the implementation of the Affordable Care Act, and saw how different lobbying interests kind of controlled what got into certain legislation, though there were a lot of great people fighting for really good legislation. But when I transitioned over to the medical billing industry, I saw something that was pretty different from what I had seen before. Medical billers, they're in the trenches. They're not really focused on all that outside stuff. They're working day to day, working with changes in insurance regulation, working to really understand, what they can do for their providers and patients. They answered calls from disgruntled patients. I've answered my share of disgruntled patient calls. And really, there's nothing that billers can do sometimes. They do billing the right way. They submit to insurance the correct way, but it still ends up falling to the biller to be, perfect, where we all know, nobody's perfect. And really, as a biller, I found that sometimes it can be hard to get ahead. And first, really what I saw is billers are busy. For many of the billers I spoke with, billers, they transitioned to this career. Some, they became entrepreneurs and they wanted that flexibility of setting their own schedule. Some, maybe had recently started a family and became billers and coders because, they could drop the kids off, do some billing and coding, take a little bit of time to pick them back up. And there really can be some flexibility in regards to billing, but it's kind of what happens when you're just too busy in general. Flexibility can only help you so much if you're too busy to reach through every task. And working with billers, I'd schedule meetings all along the days to accommodate their schedule. And every month there's always a month end, and for a biller, while they desire flexibility, your practice isn't waiting for your month end report. They want it on the first. And for insurance companies, they're not waiting on the 91st day for timely filing. They need it before their timely filing runs out. And for a patient, everybody knows once you got a patient on the line, it's really hard to get them off. They need their question answered then. And I always saw, it was billers who were the ones whose schedule had to move around for everybody. For me, that meant moving my schedule around for the biller. So I'm glad there was at least one person to really accommodate the biller. They'd have to move a meeting from 4 to 6 to accommodate a last minute meeting with a client. And for me, that'd be 9 p.m. So I truly understand, that biller frustration, having to really be the last one on the totem pole sometimes. And speaking of, being busy and being that last one on the totem pole, I found billers are really, really underrated. There's some really cool folks. And, medical billers at the end of the day is what makes this whole medical industry possible. Medical billers make sure, your providers are paid so they can keep their practices open. During COVID, I saw medical billers scrounge the new telemedicine regulations, see what CPT codes could be reimbursed, what modifiers they needed, what were the better reimbursable rates. And, they really took those changes in stride. And, as a matter of fact, for me, I started working in patient billing, medical billing 4 years ago, and I get two reactions when I tell people I work in medical billing. So the first reaction, I don't know if any of you have gotten this before, it's just kind of it's a blank face. They go, I work in medical billing. They go, what? Or the other reaction is, I say I work in medical billing, and then all of a sudden they start going off on a diatribe about what happened, when they got this bill from their insurance one time. And I know that can be really frustrating, taking that call from the patient. But really, what I also saw is billers, they're truly compassionate because, when a patient has an issue, you really should be working for them and really should be hearing them out and listening. And that's 100% the right way. And that's what billers do. And billers do the same thing for their providers, and their providers can be frustrated. And billers work with them to alleviate their concerns. And that's what billers need too. Billers are deserving of that same respect that billers always give to their practices, to their patients. And it just kind of reminds me, I know the Super Bowl was pretty recently, and medical billing reminds me a bit about the Super Bowl. And it might seem like a non sequitur, but let me explain. So, if you follow football, you might know that the quarterbacks always get the glory. And even if you're not following football, you hear the conversations about Tom Brady, Patrick Mahomes, who's better. And those who get the media coverage. But, if you look at it, in this year's Super Bowl with the Tampa Bay Buccaneers, they won the Super Bowl. The Tampa Bay Buccaneers had a top-rated offensive line, according to Pro Football Focus. And if you look at this picture here, this is an old picture of Brady at his finest. I'm a Jets fan, so this is actually very concerning to me. But he's out of the division now, so it's much better. But if you look at this picture, he's about to deliver one of his patented, great throws. But if you notice his offensive linemen there, none of them get the glory, but he's got a perfectly open passing lane. Nobody's in front of him. And that's what billers are doing. Billers are making sure, there's nobody in the way for these providers. There's nobody in the way for these patients. Billers are the one in the trenches, making sure the system works. They make sure the system keeps going, or, they make sure that the QBs can keep throwing. And, sometimes with this lack of glory, I find that also the medical billing career, I speak with some folks, can feel stifling at times. Heck, if you go on some of the job websites, medical billing doesn't have a standard industrial classification code, which just means that, when you're going through one of those website clickers to choose your career, oftentimes medical billers aren't even on that list. And another thing, I'm really impressed with medical billers about is, they work with, dozens of electronic health record systems, electronic medical record systems. A few billers work with multiple practice management systems, multiple specialties. Some only work with a few, but they have various terminology. And I find even just, when I was learning the industry, it can be difficult to keep track of these different systems. And it can be hard to, one, be efficient. And, what we find is if you have to work on all these different metrics and criteria, it can be difficult to have that efficiency. And one, when you're looking as a business or as a career, if you're not able to get that efficiency, it's hard to translate those skills over to your next opportunity. And, one final thing is, I actually, Inbox Health, we focus on the patient responsibility portion. And what I saw with a lot of billers, it's changing now, but they weren't really concerned about their efficiency just with patient billing in general. And if you have low efficiency, that's going to hurt productivity of the medical billing industry, and the lower productivity of the industry that, suppresses career earnings, because if you're in a higher productivity industry, you're going to have, better earnings as well as profit potentials. And, medical billers, much like their football offensive linemen, brothers, we're just wading through the muck, doing what we can, really getting down to business so we can really make other folks excel. And seeing all this, seeing the rescheduled calls, seeing the urgent client issues, seeing the patients, hearing the patients upset when billers did everything right, as Julia said, it almost drove me to the brink. It almost drove me mad. But instead I thought, what could I do to contribute to these billers? They're doing so much every day. What can I, just as one person, try to do? And it's tough because, as we went through, billers have all these different things they're looking for. They're helping providers, helping patients. They have different PM systems. They have different metrics they're looking for. I mean, heck, even quarterbacks, all you really have to look at is your quarterback efficiency rating. And then, it hit me, what if those linemen who are protecting Brady had their offensive lineman rating? Then they could show folks, hey, I got my offensive lineman rating. I'm doing a great job. But then also the coaches could go back to their team and say, hey, we have this offensive line rating. What can we do to improve? Even with passer rating for quarterbacks, Brady has a 97 passer rating, and you don't need to know anything about quarterbacks to know 97 passer rating is probably pretty good. So then I found it. The patient billing score. The patient billing score will be and can be your one-stop shop to show, one, to the world, to your fellow billers, your practices, your patients, what a good job you're doing for them and what a good job you're doing for the community in general. One day I hope that we can truly have the Society for Better Billing, that we can raise the esteem of billing, and it's going to be all of us together. But today, I think what's going to be really impactful is the patient billing score. You can show your doctors and providers how much you're helping their business. You can show your patients how you're doing that best-in-class support. And you can show your colleagues, some bragging rights and how well you're doing. But, as much as, maybe I'm an egotist and everything's about validation, it's not only about validation. It's also about looking at yourself, looking at your business and finding what you can do to improve not only your bottom line, not only your career, but time for yourself. If you increase your efficiency, you're going to have more time for yourself and, for your family. So, what I'm going to do now is I'm going to go through one, how to get the patient billing score. So how you can, get that initial assessment. And then as well, once you get that assessment, what does that assessment mean and what can you do with it? So, first, in order to get that assessment, what you're going to want to do is go to patientbillingscore.com. Again, that's patientbillingscore.com. If you're on the computer, I think you should still be paying attention, but you can literally type in the link. From there, a lot of people have invested time and resources to make this the best experience possible. If you have any feedback, we want to hear it. But we have this great site. And once you're there, you can go ahead, click start. And once you click start, you'll be beginning to see the questions. And when you see those questions, then you'll get also a little bit of an understanding of, okay, what's the criteria here? What's the score about? And that'll also help foster learning. Like I say on all my trainings, you may not remember everything from this one call, but if you go through the quiz, it can help kind of inculcate that sense of, what's going to really help you, your business, your community. And then once you've gone through the score, you get to that end of the score and it's going to go over, what are the different criteria that you're being graded on. That's what I'm going to go over now. And then it's going to go over some next steps that you can do for yourself. And that's also what I'm going to go over at the end here. So first, your score is going to be out of 4 categories. And I'm going to go over each one of these, tell you why it's important and what its use is and how it can help you in the community. And one, that's your efficiency rating. So how efficient you are at patient billing. 2, that patient experience rating, really what you're doing for your patients. 3, that payment collections rating. And that's going to be a really important indicator for your practices. And then that data accuracy and accessibility rating. And that's going to be really how you can show to everybody, hey, I'm doing a pretty good job with your bills, with your claims, and here's what I can do to show. So first we have that, to me, this is the all important efficiency rating. If I can make a score and it was one thing only, it's going to beat this efficiency rating. And the reason why it's that is because, your efficiency rating is going to help your bottom line as a career or a business. It's going to help you save your own time. And you can choose, once you have that time back, what you want to do with it. And, just to give you maybe a couple examples, I've at Inbox have had really a great opportunity to work with, some amazing billers and clients. And, as we've grown, we've learned, we've actually done case studies on these clients. Julia has done these case studies as well. They're really a great part of what we do. And, when I did my first few case studies, I said, oh, wow, I'm really excited for these metrics. They got more payments for their practices, and, they're really doing some great work. But when I spoke to the client, I was all giddy to present my metrics, and they were really good, and they were very happy about it. What the biller said was, what I noticed most about Inbox is I have more time on the weekend. I have more time to spend with my family. That's what they noticed, and it really took me aback, because there are some folks, and I think it is really important too to be focused on your career, profitability, flexibility. But like I said at the beginning, that flexibility that you get from becoming a medical biller, we want you to realize that flexibility and not have it be a dream of when you first came in. So that's one. And then the next is, I was speaking with a biller the other day, and it's funny, I prepared for this webinar as best I could, and I just keep talking with billers and getting new experiences. And I say, sorry, I gotta scrap the script. I got a new good story to tell. But this one I thought was really interesting, where there's a biller, and they do COVID testing. So obviously, the COVID testing has increased, a lot during this time, and they've actually increased billings 3 to 4-fold. And what they told me is, in the old paradigm, when they weren't focused on efficiency, if they would have increased billing 3 to 4-fold, that's how much their costs would have had to increase. But instead, they said they've only had to increase their costs around a fourth or 50% more, much less than they've ever had to do with that increase in billings. And for them, that was what they were really focused on, their efficiency. And when you're there, it's really going to pay dividends, either personally or for your business. But then, as I was discussing earlier, I wish it could all be about efficiency, all be for the biller, but also billers serve with purpose, and they serve their patients, and they serve their providers, and they serve their billing community at large. So I'm going to go over how the patient billing score helps encapsulate that as well. So next, we have that patient experience. And I know oftentimes you tell your providers, your patients, you're doing the best you can for them. And it's really true. And I work with these, great billers. But I think a lot of the reason why, the patients get these stories and the practices get these stories, not necessarily about medical billing in specific, but about the medical industry in general. And if you look at the insurance portion of the industry, I was there, working at a brokerage, and you just hear the horror stories. And I've had to advocate for patients where, they call the insurance, they get the rope-a-dope, the insurance company isn't open. When you receive things from insurance, it's very confusing. But, for the medical billing industry, there's a temptation to not excel. But what I found is that's not what billers want to do at all. Billers do want to excel. So first, how can it be different? How is the medical billing industry going to excel? And one, we can provide patients a much smoother experience. We have the ability, and billers have the ability to, if the patient, if they're calling after hours, instead of saying, please call again to make your payment, which is frustrating, the patient can make the payment directly from that call, regardless of whether or not somebody's online. Even for myself, and this is a little embarrassing, I almost got sent to collections on a medical bill once, and it's not something I really like to talk about. The bill wasn't so much, I was lucky to be able to afford it. I know that's not always the case, but they had me mail in a check. And quite frankly, I didn't get a checkbook until like a year and a half ago, paying my new place's rent, my old rent. They used to accept a Venmo for it. But they kept sending me these bills, and I kept ignoring it. And then, I'd get a little bit more nervous, and I'm sure the practice wasn't very happy about it. But on their last bill, they actually had a pay online slide. And I was like, okay, actually, I can do this. And it sounds silly, but sometimes for patients, that's what it's about. It's about something that you didn't expect and you didn't know was going to help them breathe easier, help you breathe easier, and really make everybody happier. And when that happens, what you're doing is not only supporting that patient, not only supporting your billing company or your provider, but you're really supporting the medical billing community as a whole and the medical industry as a whole. Because when that patient is happier, that's going to reverberate and they're going to pay it forward and they're going to talk about their happy experience. So the next person I tell, I work in the medical billing industry, they can say, oh yeah, I know somebody. They had a really nice, convenient experience. It's probably not what you hear so much now, but if we work together, I think it's something that we can really do. And from there, we talked about the patient stakeholder. And what I find with payment collections, in addition to the billing company, the important stakeholder are also providers there. And, as a billing company, think about your own revenue and cash flow and how important that is, to any business. But for a practice, it's a huge lifeline. In the 80s and 90s and much before, insurance, they paid, a large percentage of the total revenue to the practice. But now patient portion is really getting to be much more important for practices revenue. And some practices, they haven't noticed the difference, but billers have. So billers are noticing that difference and making sure they can support them. And then one thing, and I think this is pretty unique to the medical billing industry and how it goes to their practices. You really have a great opportunity to hugely improve patient cash flow. So, let me go to an example of maybe another industry. And, I'm trying to buy something on Amazon and, maybe something's in my cart and I haven't bought it yet. Amazon can send me an alert, hey, buy the things in your cart, and I'll get reminded and buy it. And maybe it increased the cash flow by 1 day because, I was going to wait a day, but instead they sent me the alert and I purchased it and, it was 1 day of cash flow. But for medical billing, you can increase cash flow much more because, if you're sending a paper statement, that paper statement is taking a week to arrive. Some people only look at their mail once a month or none at all, no times at all. And then once they do, send in the check in the mail, another week. It can be another week to process that check. You're looking at a month of time or more just on friction costs, as opposed to what you can do is send a message in a way patients want, as we were talking about with patient experience, and they can pay that same day, get a text, pay it then, get an email, pay it then. And that's going to be an opportunity to improve cash flow 30 days, 45 days. And that's a huge paradigm shift for a business. If you can get paid 30, 45 days sooner, that increases your opportunity to serve patients, increases your opportunity to grow as a practice. And we just happen to be fortunate that that's an opportunity that can be afforded because of medical billing. Because like I said, in other examples, sometimes you can only, increase cash flow on the margins. And lastly, what you're doing for your practices, that's helping providers stay afloat. And, I did a webinar, at the beginning of COVID 6 months ago. And at the beginning, a lot of practices closed down initially. But what we found is that practices who had options for better cash flow, they were less likely to, close down based on, our survey results. So that can make all the difference. And you may not notice it now. And while times are good for the practice, maybe the practice may not even notice, but, to be prepared for that, next downturn. As a millennial, it seems like you get them every 10 years, but, just be prepared for that next crunch so that you don't have to say, oh, what can I do now? You don't want it to be too late. You can be proactive and you can tell your practices, hey, this is paying good dividends now, but you're going to be really happy that I've been focusing on this for you for the next issue that comes up. And really lastly, this is the data accuracy and accessibility rating. And you can say, wow, that's a lot, that's 3 words, but let me see if I can kind of crunch it down here. So data accuracy and accessibility kind of puts together 2 concepts. So one is data accuracy, and that's to say the bills that you're submitting, on a first claim basis, the bills that are going to patients, you want those to be accurate. You want patients to have confidence, and you want your providers to have confidence to say, bills are going out correctly. I was actually just talking with a biller yesterday or the day before, and she actually might be on the call, but she was saying, one of her insurances was giving her an issue, uploading supporting documents, that they would only accept the supporting documents after it's been initially adjudicated for an appeal. So we know there's never going to be a process that's going to get you to 100% accuracy. But what you can do is you can have, a statement review that's automated that says, if it doesn't pass these criteria, I don't want it going to patients. If it's a denial, I don't want to go to patients. So that can increase your data accuracy because you're not sending out those bills that the insurance company won't let you bill right the first time. It's a toughie, but billers get through it. Then as well, what that does is it improves your provider satisfaction. If a patient isn't getting a bill that they shouldn't have gotten due to no fault of your own, the patient's happier, the provider's happier. And quite frankly, I was a person who answered phones. I don't want to say, the happy wife, happy life, but happy patients, happy practices, happy biller. I found that, when I was on the receiving end. But also not only on the accuracy portion, but it's also the second portion of accessibility. And that's to say, helping patients understand their bill, even if it's, 100% accurate. And that's to say, going back to the insurance industry, it's just, where I have a good amount of my experience. And also has to do with medical billing. When they get that explanation of benefit, that EOB, I even get confused with it sometimes because, it's not completely standardized and the wording can be quite confusing. And for patients with no or low experience, it's extremely confusing. So taking that over to medical billing, it doesn't have to be that way. If you can have the payment reason codes be more simply understood by patients, to be in simpler wordage or terminology, that's going to really help them, help patients, and it's really going to pay it forward. And by pay it forward, I always like to bring it back to the community standard, where if you improve your standard of billing, that's reverberating out to other practices, to other patients, to the medical billing industry's reputation at large. And, right now, this is an exclusive webinar for Inbox Health clients only. And, you folks are getting the leg up, but we're hoping to launch this publicly as well with your help and our feedback. And, if we get this to the industry at large, this can really, be a game changer, and we're very excited for it. But to bring it back, this is exclusive to you. So what can you do to help me, join the movement? And, I don't know if you can tell, but, at the beginning of this webinar, maybe I was a little bit exasperated and upset with, all the issues that I'm sure you run across from time to time. But now actually I've found through working with billers and working on this process with, many great folks, there's something that we can do. So one, I challenge you, go to patientbillingscore.com, find your score, go through the questions. Again, that's going to help reiterate what the score is assessing on, as well can really help you start to understand, what you can do to improve. And you get to that final page once you answer the questions. It'll again go over the categories a little bit. Feel free to ask questions on, if you need some additional information on them, but it should really help you once you get to that last page. But also what it's doing, again, it's not just for the glory or the vanity of a rating or a number, but it's how we can improve ourselves, how we can improve. So that second portion is I'm challenging not only you, I'm actually challenging the 4 great people. I know them all very well. Your 4 different customer success managers here, and you'll each have a different one. I'm challenging them to boost your score by 40 points or more. And what's great is that once you take that quiz and it'll give you some suggestions, you'll be able to work with your customer success manager on a one-on-one basis to say, all right, I understand, where I am now. I understand a little bit of my rooms for improvement, but what specifically can I do, at no cost in order to improve, my score? And from there, you can decide what's most important to you, is it billing efficiency? So that's to say, all right, I value, my career, my profitability, my time that I'm able to spend with my family now. Is that what I value? Is it that patient experience that you want to go ahead and improve that patient experience so you can tell patients and providers, I'm doing what I know the best I can to provide them a really great experience. So they're going to be those consultants with you. They've been trained on this patient billing score, and that's what they're there for, to help you out. So with that, I just wanted to thank everybody for going along this journey with me. I had a lot of fun, preparing and really trying to figure out, what we can do together to improve patient billing and improve the medical billing industry as a whole. And I think, this can be the start of that process. And I know really you all have been the start of that process. And, it's the billers that we work with that have been, carrying us over the finish line, allowing Brady to make their throws And I'm just hoping that, we can be a small part of that. So with that, actually, I believe Julia has been taking some questions. So for the sake of time, went a little long here, but that's all great and good. Julia, I think, has 2 to 3 questions. And if you ask questions and we weren't able to answer them, we'll send you a follow-up email there, make sure we get your question answered. So from there, Julia, do you have any questions?
Yeah, thank you, Chris. And I'm excited to hear how many points are going to be increased by the CSM and everybody else.
Absolutely.
So I have about 2 questions, and hopefully you can answer them here.
Okay.
So one of the questions that came in was, what is the score out of, and what is the maximum score I can get?
Sure. So that's a great question. For the first portion, what is that score out of? The score is graded out of 850. And what score you should be looking to get. I mean, that truly does depend on what you're looking for. I found that most inbox health billers are graded between the 450 and 750 range, and it's really hard to get above that, but you really can go in stride. And once you're already within that 400, 750 range, uh, you can decide, what's going to be best for your billing company. What are you looking to do? How efficient do I want to be? How much do I want to improve the patient experience? And then I know this is Inbox Health exclusive right now, but we expect other billers, not using us or a similar competitor. And that's one thing to know is the patient billing score is technically agnostic. And when we do this wider release to the public, our billers are really fantastic, and we expect them, and they do have higher than average scores. But for other billers, and this can be a bragging point for you, their initial scores might be closer to 250 and 450. So if you're an Inbox Health biller, what you should be looking for is the scores out of 850. Your score is probably around 450, 500 to 750, and then based on that, what can you do working with your customer success managers and your kind of employees and coworkers on what portions of the score you're looking to improve and how that can help.
Well, on that note, the second question I had for you was, do you need a perfect score to be a good biller? And if not, what score would say that I'm a good biller, and so on?
Yeah, so I think that is really a great follow-up there. As I mentioned, you don't have to be the perfect biller. For example, we know that the payers are always going to make it difficult for you, right? It's never going to be as 100% efficiency or 100% accuracy. But what you can do is work with your customer success managers, find where you are now, find where you want to improve. And I don't say there's a be all end all. I think it's a little bit like a credit score where if you're looking to tell your practice and your providers, I'm best in class, then yes, you do want to get to that 650 range, 700 range. It's like when you want to take out a mortgage, right? You want to be at that really, really high end of the range. If you're saying, well, I'm pretty contented, of course I want to maintain on top of things, but I'm fine. No, I don't need to get a mortgage tomorrow. Then sure, you can have a score within the 500, 600 range, and you can maybe focus that score instead of efficiency on the patient experience, provider experience, data accuracy, and accessibility. So, at least for your stakeholders, for your practices, providers, patients, you can provide, them and be confident that you're serving them well. But for yourself, it's kind of up to you to decide, if you want to get all the way to the top with kind of the best efficiency possible. And that is, the highest portion of the score, your efficiency, because, quite frankly, from a health of a business and a career standpoint, I think that efficiency is most important. Though, of course, we have great care and love for our patients and providers and, the industry as a whole.
Awesome.
And were there anything else? Any other questions, Julia?
No, and we're going to make sure to send out an email after this with the recording and any other questions that have come in that we didn't answer. But thank you so much, Chris, and this is very informative, and we thank you all for joining us today.
Awesome. Thanks, everybody.